This next video in our series on ACL rehabilitation following an athlete from surgery all the way back onto the field is going to deal with the paradigm for building a foundation for functional progressions and is based on information provided by a continuing ed course taught by George Davies I attended early on in my career. Now, he built a system where he said you need to use an objective, quantitative, and systematic rehabilitation and testing strategy to safely and rapidly progress a patient from the time of injury to the return to full functional activity. His philosophy is based on a progression of going from one level only when you pass the prior level of tests in that series. And you have to have each successive test associated with increased amount of stress placed on the patient while at the same time decreasing the amount of stress in the clinic. They need to have normal range of motion and strength, a normal gait pattern, go through a walk-jog progression. Agility ladders go from single plane to multiple planes. They go from jumping to hopping, a change of surfaces, controlled to uncontrolled environments, and then back to play. Now here's an example of a single plane agility ladder drill in both the forward and lateral direction. This then progresses to multiple plane activities such as the shuffle or the front step, back step karaoke pattern that is seen here. Now we also want to look at going from jumping where they have a 2-foot landing and a 2-foot takeoff to hopping where they have a single foot takeoff and single foot landing. They also progress the surfaces from something in the clinic to maybe an AstroTurf and then into an outdoor or a court surface as is seen here. You go from a controlled practice environment where everything is sort of scripted and predictable to a controlled scrimmage environment where there's a little bit more unpredictability, and finally to a game situation or combative situation where you're actually fighting for the ball against an opponent. Now in this paradigm, we're going to do new activities before old activities to eliminate issues related to fatigue. We're going to do skilled movements like a hang clean before we do unskilled movements like a leg press or a press on the shuttle. We're going to do fast movements like the box drill shown here before we do slow movements like a squat on the TRX. We want to do our power activities like this box jump before we have an athlete do more strength activities like a tire pull, even though it incorporates movement into the activity. We want to work the large muscle groups before we work the small muscle groups, as the small supporting musculature fatigue easier. In summary, we want to do new activities before old activities, skilled movements before unskilled movements, fast before slow, power activities before strength activities, and work the large muscle groups before small muscle groups. Now I have to put a disclaimer in this and saying that although I've given you a framework, you also have to work within the guidelines of the physician's protocol when you're doing this. In next week, post-op week 7, we're going to see how these functional activities are integrated into Maddie's plan of care. If you have any questions about anything from this week's post, please put them in the forum. Thank you.